Hello everybody, welcome back to Anxiety and Depression Adventures. I'd like to thank you, those of you who have been viewing the previous couple of videos, and in today's report, so to speak, I want to talk about the whole concept of the stigma or social stigma or that self-conscious effect that those of us who struggle with mental illness often are faced with. We're faced with second guessing other people's opinions, and if you work in an office environment with colleagues, it will vary in your own mind the degree of honesty to which you feel comfortable sharing with your manager. So, and this is something that obviously for many people is an area that they want to be very careful in managing because you feel it will have an impact on your career in the sense that people will view you as being weak in some way, or you've had a breakdown, a nervous breakdown as they used to call it, or what have you. So it's a very touchy area. And from my management experience as an executive and also as a victim of this disease, which is what it is, I wanted to focus specifically on this area. No real silver bullets in the way of answers. There's no one best way to handle it, in my opinion. It really depends on your comfort level, your work environment, and this applies to families as well. So it's not just your boss. So let's take a scenario. I'll take a page out of my own book. When I was diagnosed, well after I was diagnosed, I had continued to work successfully for a couple of companies in a senior management capacity. And with the help of the medications that we discussed in episode 2, I was able to maintain a level of mental concentration and perform well. Now, I got myself into a rut where, not so much a mental rut, but my marriage at home was deteriorating because, in part, of course, I was not the same person that my wife had been accustomed to for the previous 18 years. And so there was a level of getting beaten up at home, so to speak, due to the frustration of the family with my mood swings and all the other stuff. And then at work, because there was still residual impacts to my mental capacity to be able to think straight and make quick decisions and move on and just get stuff done, my efficiency level and my productivity level really took a plunge. So in order to make up for it, I was putting in 14, 16-hour days. There were times I was pulling all-nighters just to get the work done and through weekends as well. And in retrospect, I missed a ton of quality time with my young children at the time. They're teenagers now, but anyway, it drove me to the point where it was becoming visibly obvious to those around me that I was really not looking good. And it really wasn't only my mental framework, it was also physically I was exhausted. So I walked into my doctor's office after not seeing my family physician for about 4 months or so, and he took one look at me and he said, "Dave, what the hell is going on?" So I told him briefly, work's been busy. You know, my job involved a lot of travel all over North America. And my family doctor was not the type to have the wool pulled over his eyes, believe me. He wouldn't put someone out on sick leave or disability or recommend it unless he really felt it was necessary. And he sat me down and broke the news to me. He said, "Dave," he said, "you need to stop work now. I'm putting you out." He said, we really got to up the medications. We've got to try something else. A lot of these are going to have side effects to make you sleepy, blah, 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 blah. Plus, you're going to probably have a heart attack or a stroke if you keep up at the rate that you're going. I remember sitting there and bawling my eyes out in the doctor's office because I affiliated a lot of my self-esteem with work. So flippantly, well, not on my side so much as the doctor's, I said to him, well, when do I stop? This was like a Friday. I think the next week I was supposed to fly to Manhattan for a couple of weeks to visit clients or something. And he just casually flipped over his watch and said, well, it's 11:15 a.m. I'd say now is a good time for you to stop work. Anyway, so there is really where my career started to take a dive. I immediately contacted Human Resources and advised them of this, and I chose not to share the reason why. I simply said, my family physician says that I'm physically exhausted, so I wasn't lying, and I need to be put out for more intensive care. So that was the official story, and my boss was away at the time. So the company was very good with me. They kept me on salary for a lengthy period of time. The insurance company we had for group benefits for short-term and long-term disability happened to be a pretty good one. Actually, because I was one of the senior executives in this medium-sized company, they actually wound up having to renew their insurance contract because the level of income that I had was not fully covered. So they actually wound up bumping it up. So hopefully I did somebody else a favor. Anyway, so I went on disability, and I'm not saying it was, in retrospect, the right thing to do or the wrong thing. I just know it put me in a scenario where I was at home alone during the day, where the kids still went to daycare or school. My wife was working, and being in isolation and really having nothing to do other than navel gaze and have doctor appointments. I'm not so sure that was terribly productive. I got a lot of sleep, some of it drug-induced. But I was very self-conscious about any whisper that I was on stress leave, which comes with a very negative connotation among management folk, at least in my neck of the woods, because it's often viewed as people who can't hack it or people who are abusing the medical system to get out of work and that type of thing. So I was very aware of that, and I had recalled back to about, I don't know, 10 years prior when I was with a very large corporation and sitting around the manager's table when we were reviewing absenteeism, and even people that had doctor-certified lengthy questionnaires completed that approved them for short-term disability. I still remember some members, including my boss, of the management team joking about it, and one way or another knowing the specifics of the medical details, which at least in my area are intended to remain confidential. You have a legal right to that, and a lot of upstanding companies, the best ones that you work for, they adhere very strictly to the policy that it's really between whatever physician the company hires to sign off and assess you and indicate, yes, this is a valid reason, but they don't tell the company and they don't tell your manager why you are off work. It's simply a matter, you're off until this date, and the downside to that is, well, there's a ton of paperwork to be filled out, and doctors are sluggish on getting forms filled out, and if they're not returned to the company in a timely fashion, you can have your salary cut off, your benefits cut off, and it really adds a level of stress that you don't need at a time when you're truly ill, all for the sake of one or two bad apples that in the past have taken advantage of the system. Anyway, fast forward from that point back to my own leave of absence. I knew exactly what people would say and talk about because I was appalled years earlier by these meetings we would have. And I knew some people probably were taking advantage at the time, but I always preferred to place trust in the fact that if our company doctor, having reviewed the documentation of the attending physician, agreed that yes, this person qualifies for short-term disability and should have their pay and benefits continued, that, it would remain confidential. I think a lot of people want to be honest with their manager and believe that their manager will keep it in confidence. In the real world, I think it really depends on who that individual is and how much integrity that they have and how much they really care for you as an individual. And that's why I prefaced my remarks at the beginning of this episode that only you can really make the choice as to how widespread you choose to share this type of information because of the stigma. Now, ironically, let me see. I was put out on disability at the around the middle of August, 7 or 8 years ago, and my insurance company, as I mentioned in previous episodes, was exceptional with coming forward with resources, paying for a psychologist for me to see, paying for a fitness membership so I could get exercise. They were really, really good at that. Anyway, by the time Christmas came around, I felt that, okay, I think I'm on the right path. We've got my meds settled. We've got a lifestyle change in place. I know I can't overcommit when it comes to workload and so forth. So having been a manager and now at this point an executive, I just sort of routine every few weeks or so I would call my boss and just have a brief chat with him. And unfortunately for me, in my scenario, I did share with him the fact that, I had been dealing with anxiety my entire life and also bouts of depression, and that coupled with exhaustion just put me out. So I contacted him as well as the insurance company and said, okay, David's ready to start back on a graduated return to work program, which is very standardized for people that have been off work for like 3 and 4 months or longer. You can't go from 0 to 60 overnight. It's not a wise way to try to get back into things. And at least where I live, there is labor legislation that dictates an employer has a legal obligation to make medical accommodations for individuals in these type of scenarios. Unless it's overly burdensome. And I guess that's a phrase that only a court can interpret. And my manager is quite clear. Dave, how do I know that this isn't going to happen next week if you return tomorrow? How do I know that, you're not just going to call in one day and be gone again for a month? How can I bring you back into the company? I can't just bring you back part-time, which would be normally the plan. And I was astounded. I was on the phone. I still remember sitting in my living room thinking, well, I don't mind stuffing envelopes for the first week, half days, sitting at reception. I don't know. God knows there's tons of reports I could be taking care of. Because they obviously already had a structure in place once I left to back up my role and graduate into it. But it was very obvious he did not want me back. He did not trust that another episode, as he would call it, would not reoccur. And my response back, very politely, was, well, we also don't know if I'm going to be hit, or you are, by a Mack truck tomorrow morning. How can we predict these things? So I had a very in-depth conversation with the insurance company, but of course the insurance company is paid premiums by my employer. So they're kind of caught in the middle. Everyone agreed. My doctors, the psychologists, the insurance company, everyone agreed at the time that they were very shocked that I was being placed in a position that was very unusual, where a company of that size would not entertain a graduated return to work. And in my boss's mind, it was either 100% or stay out on long-term disability. So I wound up staying out. And that was very much, unfortunate for the situation. Anyway, so getting back to your work environment, whoever's watching this video, you all have different circumstances. So I'm just assuming people are working. Now, in this type of thing, you do need to take it under consideration as to whether or not it is wise for you from a health perspective to leave work. Because in retrospect, I think if I had gone to my vice president at the time and told him, maybe not all the details, but enough, because he was one of the people that told me I was looking like shit and I really needed, to take care of myself. And he knew I had stressors at home from a family perspective, my marriage in particular. I'm kind of wondering if I had gone to him instead, and rather than take time off work, which was the easy way out, if we talk about escape and trying to find instant relief and this sort of thing, I wonder if I had had the conversation with him and says, look, boss, I'm overloaded. My physician recommends that I go off work. I don't want to, but you need to take workload off my plate. I don't know how that would have played out. I guess I'll never find out. But that might be another option, because staying at work can be an area where it enables you to still socialize with other people. The fact that other people may know that you're ill or that you simply have too much on your plate is not necessarily divulging a whole lot of stuff. So, it really depends on your scenario. But if you've got a choice at all, and this would be a discussion you would want to have between yourself and between your physician as to whether or not going off work and then being totally isolated as a consequence versus staying at work but negotiating with your boss to somehow or other reduce your workload, then there may be some benefit to remaining in some sort of social situation. So that's something to consider when you're going on that. Now, the medications that you're on, they obviously, as we mentioned in a previous episode, will have some sort of side effects. If it's just weight gain, then that's not something that's really going to cause a lot of problem. If, on the other hand, it's going to knock you out and you're going to spend 2 weeks in bed getting acclimatized to these meds, then that is something that you do need to take into consideration. So, that's a no-brainer when it comes to that one. And only you know your coworkers and your work environment sufficiently to know whether or not to tell them exactly what it is that you're going through and to what degree. Officially, it's none of their business, but let's face it, people are going to jump to the most negative conclusion that they're going to wish to. That's just human nature. So you know best in your arena, wherever you are, be it your family or be it your coworkers, exactly how much to actually share with them. And it's one of those catch-22s. If you say, I don't want to talk about it, they're going to jump to conclusions, accurate or otherwise. If you give them a little bit, they're going to take a mile. And if you work in an office with 300 other people, then, well, that whoever repeats it is going to just spin it and spin it and spin it forever. Amen. So there's really no simple answer to it. If you exit the office environment, same thing's going to happen. Whether or not your boss knows or he or she doesn't know, it's simply a matter that people are going to say, oh, he or she is out on stress leave, whatever. And let's face it, even your closest of friends that you may work with that you feel won't divulge information, they're not bad people, but let's face it, there's nothing better than a juicy story. So, don't put a heck of a lot of trust in people when it comes to, keeping things private. So these are just some considerations. And if you're facing this right now, I don't think watching this video is going to do you a ton of help. But I did want to share with you my own reflections when I went through that process, so that at least you had some considerations in your mind. Don't put your health at work at risk to protect your own definition of your self-dignity. If you need the time off, then you need the time off, and it's as simple as that. But if it's you're sitting on the fence type of thing, these are just some things to bear in mind. Now, there is something before I give you my tip of the episode that I really want to emphasize, because some of you who have been following this channel may have noticed that I have not disclosed my name, I have not disclosed any email address or any other thing, anything obvious. And the channel name is somewhat cryptic and blah, blah, blah. So who is this coward on the other end of YouTube that's shelling out all of this supposedly wise advice, yet he's still obviously too embarrassed to, run the risk that someone he knows is actually going to recognize him. The whole issue of stigma, that's a topic unto itself. And yeah, I have addressed the office politics part of it in this episode. But it's a societal issue. It's one that does need to be talked about. And I have, with my family, with my coworkers, with my boss. Some of it I regret mentioning because of the reaction. But once I really accepted the fact that this is something I need to live with, I'm a huge proponent for mental wellness awareness campaigns of all varieties, and not shoving it under the rug and not telling people and that sort of thing. I'm only putting up this video under the sort of the workplace silo because we do live in the real world. And the real world is not perfect. Your coworkers are not perfect. You're not perfect. And you may not be in the right frame of mind to make a lot of decisions. So while I absolutely support the idea of not concealing a genuine disorder that you are struggling with very painfully and your family is being impacted by the same token, I want you personally to be protected by unfortunate consequences from likely well-intentioned people, but very uninformed people that think we're nuts, or we think we've had a breakdown and we're never going to recover. And right now, in my case, after my last job with that boss that I was referring to, I have not worked for another company in over 6 years. I wound up starting my own company and resigning once I felt well enough. And unfortunately, it didn't work out. And my wife and I lost our home. We wound up breaking up. Lots of sad stuff I could share with you, which really didn't help my mental health too much. But right now, I'm in job hunting mode, and I happen to live in an area where, a lot of people know a lot of people, and, it doesn't take much more than one or two to recognize you. So, yes, for the moment, I'm purposely concealing my full identity. So accept my apologies, but I hope that you will understand. Okay, the final tip of the episode. What can help you? What are the key takeaways from this whole thing? Only you know the best path to follow in the workplace. I don't presume to know who your boss is, what they're like, what your coworkers are like, what the gossip mill is like in your office. If you're fortunate to work in a very small work environment, maybe, it's just you and 2 or 3 other people and you've worked together for 20 years, that may be probably the easiest scenario to deal with. On the other hand, if you work in a very large organization and there's 200 or 300 people that are used to seeing your face on a regular basis, and you really don't want all of those people knowing what's going on, you may want to be more discreet. And again, don't take it to the bank that if you share in confidence with your boss, that your boss is not going to repeat your situation to their boss with any amount of accuracy. Not that they should be repeating it at all, but, it can happen. And people are going to make judgment calls in the background, and you are probably mentally in the worst position to be faced with any kind of paperwork crap or request for a second opinion or any of this type of thing. So, but only you really know. So be true to yourself. If you wish and feel very comfortable sharing the full story or a chunk of it to help your manager understand, by all means, go for it. If, on the other hand, you feel it's a very sensitive topic and you're really not sure how this is going to play out, then I wouldn't share a darn thing. I would simply bring in whatever paperwork they require to get you on disability, whatever your insurance plan is, and be gone. I always recommend, just based on my own management experience, stay in touch with your boss. Once every few weeks, send them an email, leave them a voicemail in the middle of the night, I don't know what. Still not divulging any details, but just keeping them in the loop. It makes you look proactive. It makes you look like you do understand they need to know how long you're going to be out. And you might not know, but at least they know that they're hearing from you on a regular basis. Better that than them calling you at home and you being caught off guard and not sure what to say or whatever. So the tip is, be true to yourself. Be aware of the downside of being overly honest, but do what you feel is right in the long term. And don't worry about the rest of your career. We do come back from this. So if you wind up having to be off work for 18 months like I was, then so be it. That's what you need to do. And if you need to return to work in a graduated fashion, that is, 2 hours every other day for the first week, and then half a day for 3 days a week the week following, and you, over the course of 5 weeks, work yourself back up to part-time. I truly hope you work for an organization that will support that, and depending on the jurisdiction that you're in, you can check with the labor rights legislation that's in place and see what you are legally entitled to. Not that any of us in this type of scenario is really up to a legal fight, but nonetheless, it again is something for you to be aware of. I hope this has been helpful. I do appreciate you folks viewing. I appreciate any likes or dislikes you want to click on YouTube, comments, questions, anything of the sort, subscriptions. Again, I'm doing this as much for any of you that can hang in there as I ramble through these 30-minute videos as I am for myself and my own therapy. So thank you very much, and I hope you all enjoy the rest of your day.